Hello, this is Jeff Bellinger here for another 2 Minute on Tuesday. Here we are in the middle of July, but the open enrollment period is coming up soon, and we wanted to revisit a plan that's starting to get some traction out there. A lot of people still haven't jumped into it, but it's called reference-based pricing plan. State of Montana uses it for their state health plan, and they've had great success with it. It really is, the bottom line is that you take your health plan and you make a decision that you're going to pay the healthcare providers based upon what they're accepting from the federal government as far as Medicare. And then you usually apply a factor on top of it, like most people, somewhere around 30%. The state of Montana actually is about over 200% higher than Medicare, but it's still considerably less than the crazy amounts that you see on the bills from the doctors and hospitals and labs that you visit. Certainly one of the things in the 30 years that I've been in the business is, healthcare costs and pharmaceutical costs have gone crazy. They're like a runaway train that nobody can rein in. But Medicare certainly has done a good job. So you have a lot of administrators out there that are coming out with these called reference-based pricing plans. And what we wanted to do was, if you've never heard of it, give you a little bit of insight on it today. And then if you want to, talk to your benefit consultant about taking a look at one during your upcoming renewal. Give you a quick example. Most of you are familiar with PPOs. Most of the big providers are obviously using PPOs. The PPOs can typically reduce a bill by 50 to 60%. So when you see the crazy amount from the providers, the insurance companies, PPO will take that down by about 50 to 60%. Medicare costs are way below that. So, a typical cost that you might see for a $400 lab fee, Medicare might be paying $10 on that $400. A $25,000 hospital stay might be $3,000 under Medicare. So there's the way reference-based pricing works is the plan develops a cost for Medicare plus a little factor to say, here we're willing to pay more than Medicare, more than the federal government, and that you work with not only the third-party administrator but a full suite of legal people behind that will fight those bills until they get eliminated. Because usually what ends up happening with these plans is, if you're billed $10,000, Medicare is going to pay $3,000. You submit $3,000, or your third-party administrator submits $3,000. There's going to be a $7,000 bill outstanding out there. With reference-based pricing, they've used legal means to fight that amount that the federal government has established as a fair amount for that. It should be fair for everybody. So it's a little bit different plan out there. I'm trying to give you just a quick synopsis on how they work, but we'd certainly like to get in depth with you. It can save you quite a bit of money, but it'd be a radical change to the way that you're providing health care for your employees. So reach out to us. Be happy to talk to you more about it. Otherwise, enjoy the great weather we got here going, and we'll talk to you next week. Thanks.